Good morning. My name is Lisa Valdez with Hoag, and I'd like to welcome you to our Medicare Benefits class. For those of you who registered for today's Medicare Benefits class, you should have received an email with a PDF of the presentation. If not, the information will be in the description with a link that you can click on. We've included a comparison sheet for you to write in. This way you can follow along with our plan representatives in writing in the benefits. This way you can do a comparison yourself. Just to go over our agenda today, I'm going to speak a little bit about Hoag and our network. Our Medicare overview will be presented by Jeanette Perturka, who's an independent agent. She'll be giving you an overview of the basics of Medicare. And then following, we'll bring up our Advantage Plan representatives. There are insurance representatives. They'll come up individually and discuss and review their Medicare Advantage plans along with the benefits. Now a little bit about Hoag. Hoag has two main hospital campuses that are located in Newport Beach and Irvine, 13 urgent care centers, and 9 health centers throughout Orange County. Hoag's medical staff includes more than 1,700 physicians representing 52 different specialties. And Hoag has their 5 specialized institutes, which is our neurosciences, cancer, heart and vascular, our women's pavilion, and our orthopedics institute. So here we have a couple of accolades. Hoag has been ranked the highest ranked hospital in Orange County by U.S. News and World Report for 2020 and 2021. So that's always exciting and an honor for us. Hoag in your community is committed to providing healthcare services throughout the communities that we serve. And below you see a list of our Hoag Health Centers, Aliso Viejo, Costa Mesa, Foothil Ranch, Huntington Beach, Irvine Sand Canyon, Irvine Woodbridge, Irvine Woodbury, Newport Beach, and Tustin Legacy. For our Hoag Health Center in Foothil Ranch, it's one of our recent health centers which opened up in January. It's a comprehensive health center offering primary care, urgent care, pediatrics, imaging, labs, sports medicine, and physical therapy. One of their main focuses is specialty care, where both health and wellness have been integrated through a Hoag lifestyle program. This lifestyle program is customized and prescribed by your physician. So Hoag believes that the community will learn an entirely new way to attain, maintain, and celebrate good health. Hoag's recently opened some urgent care centers in Irvine, Foothil Ranch, which is the one we just went over, and Newport Coast. So for all 13 locations, you're able to view wait times and reserve your spot, which is an online feature that you can access through hoagurgentcare.com. Our urgent care centers are open 7 days a week, and keep in mind, Hoag's urgent care centers have both on-site labs and x-rays. Hoag Medical Group gives you full access to Hoag Hospital and specialists. Hoag Medical Group has over 100 physicians with various specialties. So if you're looking for a specific specialist, primary care physician, or a specific location, and you'd like more information, go on to our Hoag website, which is hoagmedicalgroup.com. Hoag Medical Group wants to be sure to always offer the patient a centric experience, and one of the ways we've done so is by offering same-day appointments for our established patients, and again, access to after-hour and weekend care, and to after-hour appointments and weekend care through our Hoag urgent care locations. And as you can see, they have our urgent care locations listed below. One other way to gain full access to Hoag is through our Hoag Physician Partners, which is made up of both primary and specialty care physicians, again practicing in 52 different specialties. So these here that you see, these are our Medicare Advantage plans that are accepted by Hoag. So later in our presentation, a plan representative with each plan will come up to review and discuss the benefits for each plan. But first, I'd like to turn it over to Jeanette Perturka, who will share an overview on the basics of Medicare.
Good morning. I am Jeanette Paterka with Paterka Insurance in Newport Beach. I'm a licensed insurance agent, and I'm here to present Medicare overview for you today. This time of the year is where Medicare releases new information for the new calendar year in 2021. So some of the information, the presentation is actually going to be based on 2020 information because we do not yet have the updates. And other information that's notated in red is the new information for 2021. So let's jump in. What we're looking at here is the new Medicare card. What's different about the new Medicare card is that previously an individual's Medicare number was their Social Security number, and now it is an alphanumeric number. What you want to remember about the card is when you enroll in any type of Medicare insurance plan, you want to indicate your name exactly as it's stated on your card. So in this instance, you would want to make sure you used John L. Smith. You want to indicate the Medicare number, and then you have Hospital Part A and Medical Part B. You would need to indicate the coverage start dates for both of these parts of Medicare. So what is Medicare? Medicare is health insurance for people who are 65 or older or under 65 with certain disabilities. You have to be deemed disabled with Social Security to be eligible for Medicare. An individual with end-stage renal disease, which is basically you're on kidney dialysis, or if you have Lou Gehrig's disease. There's different parts to Medicare. Parts A and B are what we would consider original Medicare, which was actually enacted in 1965. Part A covers hospital, skilled nursing facility, hospice care services. I like to think of it as the facility portion when you go into an actual facility. That's covered under Part A of Medicare. Part B of Medicare covers medical services provided by your doctors, lab visits, outpatient care, home health care. It's basically the services that you receive when you are, the services that you receive under Medicare. And then Part C is what I like to think of as contracted out, C for contracted. That is Medicare Advantage plans that are offered by private insurance companies, and they're approved by Medicare. They're contracted with Medicare. The plans that they're going to be discussing later in the presentation today are contracted Part C Medicare plan holders. What you want to remember is anybody that enrolls into a Part C Medicare plan, you will never lose benefits by enrolling in this plan. You're basically telling Medicare that instead of accessing your benefits through original Medicare Part A and B, which has many gaps and holes where you might have some financial exposure, you would like to access your Medicare plan via a Part C plan, and they are required to offer benefits at least at the baseline minimum of Medicare, but in many instances, as you're going to hear today, the benefits are much richer than original Medicare. And then in 2006, Medicare started and enacted Part D coverage, Part D for prescription drugs. Some Medicare plans, many of the ones today, are what they call Medicare Advantage prescription drug plans. Those include the Part D benefit. The prescription drugs are baked into the plan with the health benefits. Or if you have original Medicare or a Medicare supplement plan, you can purchase a Part D standalone drug plan. So there's different parts of Medicare, and there's different ways to obtain those Medicare benefits. Part A of Medicare, most individuals receive Part A for no cost. And what the way that you would receive that is if you have worked and paid into the Medicare system via a deduction from your paycheck, you need to work a total of 40 quarters or 10 years. And if you, over your working lifetime, have worked 10 years and paid into Medicare, there is no cost for Part A. But if you have worked less than the 40 quarters, say if you were a stay-at-home mom and you maybe didn't work, or you worked part-time and you didn't reach that 40 quarter or 10-year benchmark, if you have a spouse that paid into the system, you can actually obtain Part A of Medicare at no charge through them paying into the system. Now, Part B of Medicare, there is a premium for all individuals, and we're going to go through that in just a moment. But depending on your income, you're going to have a Part B premium. What you need to remember is that if you're going to access your Medicare health benefits, Part B of Medicare is not an option. It is deducted out of your Social Security money you receive every month, or if you're not yet drawing your Social Security, you will receive a quarterly statement from Medicare where you need to pay your Part B premium. What you need to remember is that if you decide to cancel your Part B or you stop paying your premium and it is canceled, your Medicare health insurance will be canceled as well. So Part B is not an option. Let's see, Part C, Medicare Advantage. As I mentioned, those are the contracted companies that are through private insurance companies, and these plans can go from 0 premium per month all the way up over $100 per month. It depends on the Part C plan that you enroll in, and then if you enroll in a standalone Part D plan, there is a monthly premium. So this is the 2020 Part B Income-Based Premium Guide. So if you take a look at the second section there where it says 87,000 or less, or 174,000 or less, what that is, that's the adjusted gross income for either a single individual or a married couple. So if you fall into either one of those categories, in 2020, your Part B premium is going to be $144.60. And then as you can see, the more that your adjusted gross income increases, the higher your Part B premium is going to be. So if you jump down to the line, let's go to the bottom, $163,000 to $500,000 for a single person, or $326,000 to $750,000 for a married couple. Each individual is going to pay $462.70. And then there's also potentially a Part D income-based premium as well. If you're at that baseline level, a single individual with an adjusted gross income of $87,000 or less, or a couple of $174,000 or less, you're not going to have a Part D additional premium. But if you're one of those higher individuals that has a higher income bracket, you are going to pay a Part D premium. Okay, now we're going to go ahead and get into enrollment periods. So if you are brand new to Medicare, you're turning 65 and you're going to opt into your Medicare, that's where this chart applies. So there is a 7-month window. There's 3 months prior to your date of birth where you turn 65, the month that you turn 65, which would be month 4 in this illustration, and then 3 months after. This is your opportunity where you will need to contact Social Security, tell them you want to begin your Medicare benefits, and they will issue a Medicare card and you can enroll into a Medicare plan. What I would suggest, if you're going to opt into Medicare benefits, the month of your birth, so on this illustration, month 4, I would contact Social Security 3 months prior and let them know, and then you'll have plenty of time to receive your card. Once you receive your card, you can determine how you want to obtain your health insurance benefits through Medicare, and then you can enroll in a plan, and it will become effective the first of the month where you turn 65. Okay, enrollment period, the annual election period. So this is October 15th to December 7th. This is the time, if you're on Medicare, that you can change or enroll in a prescription drug plan. You can change your Medicare Advantage plan, return to original Medicare, or you can enroll in a Medicare Advantage plan if you're on original Medicare. So right now we're in the middle of the annual election period. This is the time for you to review your current Medicare health insurance or drug plan and determine if that's the plan that you want to be effective and enrolled into for next calendar year, so for 2021. If you're currently on a Medicare plan, you should have received a document in early October. It's called the Annual Notice of Change. It's a document from your existing Medicare insurance plan, and this document will outline and review your benefits for 2020 and then any changes for 2021. So you need to take a look at that document and determine if the plan you're on, if the changes are going to make, because they do change the benefits every year, if those changes are going to be sufficient for you in 2021. Now, if you decide that you want to make a change on a plan, you must submit your application for the new plan by December 7th. That is the cutoff, and it will be effective on January 1st. And then there is the open enrollment period, and that is from January 1st to March 31st. If you're enrolled in a Medicare Advantage plan, you have one additional opportunity to make a plan change. You can switch to a different Medicare Advantage plan, you can drop your Medicare Advantage plan and return to original Medicare, or you can and you can also enroll in a Part D prescription drug plan. Those applications can be received and submitted between January 1st and March 31st, and your application will be effective the first of the month following receipt. So if you submit an application on January 20th, it is going to be effective on February 1st. And then whichever plan you are on, as of October 1st, you are in the period that is called the lock-in period, and you're going to remain on that plan for the remainder of the calendar year. Medicare does, although, offer a few reasons while you can change your plan throughout the year. And some of the most common ones are if you move to a different service area. So say if in June I move from Orange County to San Diego, Medicare Advantage plans are filed by county, so I could enroll in a plan in San Diego. You can enroll in a Medicare Special Needs plan anytime throughout the year. And that's what those plans are, is some health plans, some insurance companies have plans that are specific to chronic conditions. So that could be if you had diabetes or heart disease, you may be eligible to enroll in one of those plans mid-year. Or if you're a full dual beneficiary, what that means is that you have Medicare and Medi-Cal, you can possibly make a plan change during the middle of the year. Or if you're low income subsidy, that's an individual that has a lower income but does not necessarily qualify for Medi-Cal. So I'll talk about that in just a moment in a little more detail. Okay, so prescription drug plans. There's 3 phases to Medicare, the Medicare prescription drug plans. And as you can see, this is the information that we have updated for next year for 2021. So phase 1 is the initial coverage limit. So when you go to the pharmacy in January and you go to fill a prescription, you're going to have an initial deductible of $445 in 2021. So you pay your medications the first $445, and then once you reach your deductible, then you start having cost sharing with your insurance company. And what that means is you are going to pay a portion. You're going to pay a portion of the cost of the medications, and your insurance company is going to pay a portion of the cost of the medications. And that is going to be, after your deductible, up to $4,130. So the way that you reach that $4,130, here's an example. So if you had a $25 generic prescription and you had a $5 copayment from your insurance company, you're going to pay $5. Your insurance company is going to pay $20. So that $25 is going to be put towards the $4,130. So when your drug costs equal $4,130, then you're going to move to phase 2, which is what they call the coverage gap or the donut hole. It's basically a different way that you pay your medications. So once you hit $4,130, then what's going to happen is you're going to start paying 25% for generics, and you're going to pay 25% for your name brand drugs. And then once your total drug costs, that means what you pay and your insurance company pays, reaches $6,550 in 2021. You're going to be in what they consider the catastrophic phase. And during this phase, you're going to pay $3.70 or 5% for generics, and $9.20 or 5% for all other medications, whichever is greater. And then the prescription drug plans reset every year. So you go through the 3 phases throughout the year. You may not get into even catastrophic coverage, but in January of the following year, everything resets, and then you start over again. So I mentioned earlier about low income subsidy. What this is, it is a federal program that individuals that are not necessarily qualified and they don't qualify to go on Medi-Cal, which is the state program. There is a federal program. What I would invite you to do is if you go onto Social Security's website, you can take a look at what the limits are. This would be individuals that are maybe on a fixed income, but as I mentioned, not qualified for Medi-Cal. If you are close to in your adjusted gross income to the amounts that they list on their website, I would suggest and recommend that you actually submit an application because they always don't include all of the different things you might be considering as part of your income. If you qualify, they will notify you and you will be able to pay $0 to $3.70 for generic medications and $0 to $9.20 for name brand medications. As I mentioned, it's a federal program. You can locate it on the Social Security website. There is a link on that website that says Extra Help, and that will take you into the section that will provide further information. So the last slide I'm going to present is a Medigap, or we also call it a Medicare Supplement Comparison Table. Medigap plans are standardized between insurance companies. So what that means is that if you are looking at a Plan N, you can see it all the way on the right-hand side of that table. If you're looking at a Plan N, the benefits will be identical between any of the companies that offer Plan N. So Blue Shield or United Healthcare or even Mutual of Omaha, they all have the exact same benefits. What you want to look at is that the monthly premium can be different for those benefits by company. So you want to take a look at the monthly premium. It's based on your age, sometimes your gender, and the premiums do go up on an annual basis. There is a monthly premium. Medigap plans cover health insurance benefits, so no prescription drugs are covered under Medigap plans, so you do need to purchase a separate prescription drug plan. When you look at these plans, you want to keep in mind the following. The stability of the insurance company. You want to go with a stable company that's been around for a while. The monthly premium, as I mentioned, can differ by insurance companies. And then you can look up or request information on each insurance company's historical rate increases. That information will give you an idea about what percentage the premium goes up every year, because in most cases it will go up every year. Also on the slide, the last thing I want to point out is over to the right-hand side. Plan C and Plan F are only available if your Medicare eligibility date was prior to 2020. From time to time, the last time it happened was in 2010, Medicare organizes and rearranges some of their plans that are available. So let's, as an example, to make sure everybody understands this, if I turn 65 in January of 2020, but I was still working and I had my employer group coverage, and I decide to work for a couple more years, so I'm covered under my employer's plan. When I go to opt into my Medicare plan, health insurance, since I was technically eligible for Medicare prior to 2020, then I will be able to enroll in plans C and F. And then the other side of that is if I am not eligible for Medicare until, say, sometime in 2021, those two plans will not be available to me. So with that, we are going to go ahead and we are going to hand it over, and the insurance representatives are going to each present their lead plan. I am going to hand off the mic to Brandon with Anthem Blue Cross. Thank you.
Good morning, everyone. My name is Brandon Roberto, and I'm a direct representative for Anthem Blue Cross. Anthem offers many Medicare products. We have a very large portfolio, including Medicare Advantage plans. We even have a PPO plan here in Orange County. We have Medicare supplement plans, standalone prescription drug plans, as well as chronic condition plans and DSNP. So if you're dual eligible and have Medicare, Medi-Cal, we can also assist and put you on a special plan for that. Today I'm going to discuss Anthem's MediBlue Select plan here in Orange County. It has a 3.5 star rating. The monthly premium is $0. For primary care physicians and specialist visits, you'll also have a zero copay, and the maximum out-of-pocket per calendar year is $900. So for all your medical related expenses, it will not exceed $900. That's your max out-of-pocket. For a hospitalization, you have a $0 copay. If you have to go to an ER, emergency room, you have a $120 copay, but if you're admitted within 24 hours, we will waive that. If you need to take an ambulance ride, it's a $200 copay. And for outpatient surgery, it's also a $0 copay. For a skilled nursing facility copay, it's $0. And skilled nursing is an in-person rehabilitation facility. For x-rays and laboratory, it's a $0 copay. MRI and CT scan is also, it has a $95 copay. Diagnostic testing is a $0 copay. Physical therapy is a $0 copay. Urgent care is also a $0 copay. And prescription drug plan is included with our MAPD plan and the MediBlue Select. For Tier 1, which is preferred generic, it's a $0 copay for a 30-day supply. It's also a $0 copay if you do mail order for a 90-day supply. And for generic, which is a Tier 2, you have a $5 copay, or if you do a mail order, it would be $10. So you save a month by doing a 90-day supply mail order. Tier 3 is preferred brand, and that's a $42 copay for a 30-day supply, or $84 for a 90-day supply mail order. Tier 4 is non-preferred brand, and that's a $95 copay, or $190 for a 90-day supply. So once again, you're saving 1 month by doing the mail order 90-day supply. And Tier 5 is your specialty medications, and that's a 33% coinsurance, and the mail order does not apply for the discount there. And Tier 6 is not applicable to this plan, so there's no medications that fall under Tier 6 on the MediBlue Select. You also get dental coverage, which is not included with just original Medicare. So per calendar year, you get 2 cleanings and x-rays every year and a $100 allowance, as well as cost savings for other procedures. We have a really nice hearing aid benefit. So if you need to get a hearing exam, it's a $0 copay, and you get a $3,000 allowance per calendar year. For vision, it's also a $0 copay for a vision exam, and you get a $150 allowance for contacts or eyeglasses. Health Club membership is also included, that's Silver Sneakers, and that gives you access to over 16,000 gyms that accept Silver Sneakers, including LA Fitness, 24 Hour, the YMCA, Planet Fitness, Crunch Fitness. So there's a lot of gyms that accept that, and you get that for a $0 copay. Transportation, you get 12 one-way trips per calendar year, up to 60 miles for each trip. Now for the extras. Anthem gives you a lot of extras for a $0 copay. One of my personal favorites is this personal emergency response system that I'm wearing around my neck right now. So this is like a life-saving device. So if you ever had an emergency, you just click a button and it'll actually contact you with a live representative that can order an ambulance for you or assist with whatever you need. And it has GPS technology so they can actually locate where you're at if you need assistance. And everyone qualifies. So if you are on the Anthem plan, you can actually call me directly and I can help set this up for you. And I'll give you my number at the end of these slides, my cell phone. Another great benefit is the over-the-counter allowance. So Anthem gives you $80 per quarter. So every 3 months you get $80, and that does roll over to Walmart and CVS for health-related items. So you can get hand sanitizer, mask, vitamins, over-the-counter pain medication like ibuprofen, aspirin. So there's actually over 1,000 products that you can purchase with this allowance. You can shop online at walmart.com, over the phone, or in store at Walmart and CVS. Another really nice benefit is the personal home helper if you need assistance with 2 or more activities for daily living. So let's say you need assistance with bathing, dressing, moving around your house, doing light chores like doing the dishes or laundry. You actually can get up to 31 days per year where we'll send someone out to help you with those daily activities for a $0 copay. Another really nice benefit is if you have a pest issue in your house, so let's say you're going to your doctor and they're like, wow, you're getting all these bug bites. We actually will do eradication at your house. We have pest control at a $0 copay. And there's also an acupuncture benefit. You get 24 visits per calendar year, and you don't need a referral. You just need to go to acupuncture that's in network. So if you have any questions, please call me. My direct line is 562-302-5231. And think of me as your personal customer service representative for Anthem Blue Cross. And now I'm going to turn it over to Diana from Blue Shield. Thank you for your time.
Good morning, everyone. My name is Diana No. I am an independent licensed agent representing Blue Shield today. My contact information will be in the right box over here. You'll have my name, my email, and phone number. But for the folks that are viewing the session not live, my telephone number is 949-226-4064. A little bit about Blue Shield. They are a non-for-profit company based here in California. They offer a variety of products such as Medicare Advantage, Medicare Supplement, as well as prescription drug plan. So what does that mean to you? You have the option to shop around. We are a one-stop shop. We'll have a plan that will fit your budget and your needs. So for today's presentation, I will be reviewing the Blue Shield Inspire plan. This is Blue Shield's leading plan in Orange County. So if you have this sheet handy, you're welcome to put Blue Shield Inspire up top, okay? This plan is a 4-star plan. There's a 0 premium for this plan besides what you pay to Medicare. For your primary care visits, your specialists, it's also a 0 copay. The maximum out-of-pocket is $999. This is the most you will pay out of pocket for your medical expenses. Hospital copay, 0. As for emergency room, it's an $85 copay. So if you land in the emergency room, they patch you up, send you home, it's a 0 copay. I'm sorry, $85 copay. But if you end up getting admitted, then that copay is waived. But what if you travel, right? What if you travel outside the United States? This plan also offers you worldwide coverage at unlimited expenses. You are just responsible for the copayment for the emergency room of $85. For ambulance, it's a $100 copayment per trip. For outpatient surgeries such as your cataract, colonoscopy, same-day type of procedures, it can range from 0 if you have it at an ambulatory surgical center, or it will be $150 if you have it at the hospital, okay? $150 copayment. As for skilled nursing, so let's say you have a procedure done and you're not 100% well enough to go home, but you do get discharged from the hospital. You'll be sent to skilled nursing. So for skilled nursing, from days 1 through 20, it's a 0 copay. From days 21 through 100, you are responsible for a $50 copay per day. But keep in mind, your maximum out-of-pocket is $999, okay? That is your cap for the year. As for your x-rays, labs, MRI, CT scans, diagnostic tests like ultrasounds, physical therapy, outpatient therapy, or occupational therapy, speech therapy, and urgent care, all 0, okay? 0 copays for all those services. This plan also includes prescription drug coverage, and I will be giving you the 30-day and 90-day supply copayment. And for the 90-day supply, you can have the option of ordering your medications through the mail, or if you like to go to Target, CVS, you will also pay the same copayment if you pick it up at the retail store, okay? Our preferred pharmacies are like Costco, CVS, Ralph's, etc. So for Tier 1, your copayment is 0 for both a 30-day and 90-day supply. Tier 2 is $3 and $4.50. Tier 3 is $35 and $87.50. Tier 4 is $95 and $237.50. And Tier 5, which is your specialty drugs, is a 33% coinsurance. And on the Blue Shield plan, there is no Tier 6. As for dental coverage, this plan does include basic dental coverages, but you have the option to upgrade if you want to upgrade for an HMO for more benefits, or PPO plan to have the flexibility of going to any provider or dentist that you'd like to see, okay? Hearing aids is also included. So for the exam for hearing is 0, and when you go to one of our contracted audiologist, you can either get a hearing aid for $449 per ear or $699 per ear. Vision is also included, so you get an annual exam every single year. It's a zero copay, and you receive a $200 allowance to use towards your frames or contact lenses. The vision administrator for Blue Shield is VSP for 2021. So VSP is widely accepted for most optometrists, so that is available to you as well. Your health club membership? Yes, we have Silver Sneakers. So as you know, Silver Sneakers is a well-known company. They contract with major companies like 24 Hour Fitness, LA Fitness, YMCA. And since we are in the pandemic, you may not be going to the gym. If you hop onto silversneakers.com, you can find online courses and information to get your fitness on, okay? Transportation is also included on this plan. You have 24 one-way trips for the year. So if you need a ride to the doctor's office, lab, urgent care, etc., it is available on this plan. Lastly, what you probably all are here for, the extras, right? What makes this different than the other companies? So Blue Shield also offers over-the-counter benefits. You receive a $90 allowance per quarter to use on over-the-counter items. So you get this nice little catalog in the mail. You can either call in or order online. You can order things like cotton swab, the highly coveted hand sanitizer, vitamins, cough drops, aspirin. So there's an array of items for you to order, and you get $90 per quarter to order any of those items. And it will be shipped to your home at no cost to you. Acupuncture and chiropractic, something new this year that's added on the Blue Shield plan. At no cost, you get 24 visits for each service. So 24 acupuncture, as well as 24 chiropractic visits at a zero copay. There is also the personal emergency response system. So several years ago, you may have heard the commercial, "Help, I've fallen and I can't get up." So we offer a very similar device, and depending on your lifestyle, your activity level, will determine which device you receive. And of course, this plan also includes telemedicine. As I mentioned earlier, it's the pandemic. Many of your doctor offices may have very limited hours, but you may need to talk to someone. There is our teledoc or telemedicine service on this plan at a zero copay. So you'll be able to speak to a board-certified doctor if you're not able to get connected with your own doctor and assess your current health and situation, okay? As I mentioned earlier, Blue Shield of California offers Medicare supplement plans. The rates are extremely competitive when it comes to the Plan G and Plan G Extra. And lastly, before I depart, for a very limited time, Blue Shield is offering an underwriting holiday. So what does that mean? So if you're currently on a Medicare supplement plan or a Medicare Advantage plan with any company, doesn't matter which company, as long as a Medicare supplement and Medicare Advantage plan, you can switch over to Blue Shield's Medicare supplement plans without answering any health questions. So no underwriting. So pretty much it sounds like it's a free-for-all, right? So for more information on this holiday or the Inspire plan, you're welcome to give me a call at 949-226-4064. Thank you for your time, and I hope to connect you via phone, virtually, or in person soon, okay? So we have up next is SCAN. Originally, they are scheduled to come today, but I think due to the weather, they weren't able to make it. However, we will have their benefit slides briefly on the screen here, but we will have the contact information for the representative for SCAN in the chat box, so you see there. Also, there is a link for you to click on for more benefits for SCAN, okay? So I'm going to go ahead and introduce our next presenter. She is here representing United Healthcare, Rosalie. Thank you.
All right. Hi, I'm Rosalie Puglia with AARP Medicare Solutions with United Healthcare, and I'm here today to talk about our Focus Plan. Our Focus Plan is a Medicare Advantage plan, like the other plans that you've heard today, and it's a great plan. Now, a little bit about United Healthcare is that they are a Fortune 6 company. They have the most Medicare Advantage members in Orange County and many other states, and there's a really tremendous stability of network and stability of the country across most all states. Again, my name is Rosalie Pulio, and I just wanted to give you my phone number first, 714-292-3796. So let's get going on the focus plan. First of all, there's a 4-star rating, okay? And the premium is 0 premium. And like most of the other plans that you've heard today, it's a 0 copay for physicians and specialists, also for virtual visits. And because of the pandemic, that's becoming quite common. So there's 0 copay for your virtual visits. The maximum out of pocket is $1,000. Okay. And a hospital copay for unlimited amount of days is 0 copay. Now, the emergency room, the copay is $90. If you're admitted, though, that copay is waived. And so then you go into your hospital benefit and it's 0 copay. Ambulance. The ambulance copay is $225. So what I'd like to tell my clients is that to call the city, because there's a city plan to which you only pay $5 a month, and it's for anyone in the household for ambulance services. So it's usually called the paramedic program, and it's really great to do, and then you don't have to pay the copay locally. All right. Also with the ambulance is air or sea, air, land, or sea. So if you are on a cruise ship, you can be airlifted, and that's all you'd be paying for. Now, outpatient surgery, whether it's in the hospital or an outside facility, that's going to be 0 copay. And if you are in the hospital for at least one day and you do go to a skilled nursing facility, then that nursing facility for the first 20 days is 0 copay. Days 21 through 30 is $100 a day. And like all the other plans, that $100 a day goes towards your out-of-pocket maximum. Okay? But you will never pay more than $1,000 for the entire year for any services. Days 31 through 100, again, is 0 copay. X-rays, lab, etc. are all 0 copay. MRI or CT scans are $0 to $50. And all of the diagnostic testing, the non-radiologicals, the biopsies, etc., is all 0 copay. Physical therapy is 0. Speech therapy, occupational therapy is all 0. In addition, we have home health, and home health is also 0 copay, based on, your doctor's orders and to come and help you with medications or intravenous, etc. Now, urgent care is 0 copay if you go to the network that you're in. If you go outside of the network, then that's going to be $20 copay. So if you're traveling up to Bakersfield, it's going to be $20. International urgent care for this year is 0 copay. Last year it was $90, and this year it's 0 copay worldwide. All of the medical benefits that I'm sharing with you today are all worldwide. Okay. Now I'm going to go over the prescription drugs, and I'll give you two amounts. One is going to be 30 days, and the other one is going to be 100 days. So what that really means to you is that gives you 40 days out of the year that you're not paying for medications, which is great. Now that's mail order. Okay. So Tier 1 is 0 copay, and for 100 days is 0 copay. Tier 2, which is 0 copay for 30 days, and for 100 days, it's 0 copay again. Tier 3 is $47 for 30 days, and then $131 for 100 days. Now, this year, United Healthcare has done something a little different. With insulin, the copay is $35, and as everyone knows, insulin is extremely expensive. So if you've hit the gap while you're taking insulin, United Healthcare will honor that $35 copay for your insulin drugs, and most all of the insulin drugs. Okay, Tier 4. It's a $100 copay for 30 days or $290 for 100 days, And then Tier 5 is 33%, okay? And there is no Tier 6. So some of the extras for dental, so you can have up to 3 cleanings a year, includes fluoride, it includes x-rays, etc. Okay. You can also have a PPO buy-up for your dental, and for this year, it comes up to $1,500 for the year benefit, okay? And that's really great to add to your preventative dental. Hearing aids, the hearing exam is a zero copay, and then the hearing aids themselves go from $375 to $2,075. Vision, the exam with an optometrist is going to be zero copay, but this year and last year also, it's $300 for glasses and frames, which is terrific, and or contacts, and that will be for every 2 years. The health club membership. So we have something called Renew Active. Renew Active is more like a wellness program. It gives you brain games, it gives you dietary instruction, etc., but it also gives you all the gyms. It's LA Fitness, 24-Hour Fitness, Curves, Crunch, Crush, all these other different gyms that you can go to, and as well as the YMCA. So that's really terrific. There's another thing as far as Renew Active is that you can earn money by going through different steps, getting your mammogram, having your exam every year, etc. So that calculates towards different things. You just call them and tell you what you've done, and then you get some gift cards sent to you. Transportation. So transportation is 24 one-way rides, and that's going to be zero copay. And we also have the Philips Lifeline, which is the personal emergency response system, and that's going to be zero. And also the monthly maintenance fee is zero. Now, podiatry. We give you 2 free visits to your podiatrist for maintenance, like ingrown toenails or calluses, etc. You can call, make an appointment. You don't need a referral. However, if you needed to have surgery on your foot, like I did a couple years ago, that's going to be zero copay, and that would go through your medical benefit. We have the over-the-counter products, and it's $50 per quarter. And you can go online, you can order what you want, and it's sent to you for free. But if you don't use it, you lose it. So you have to make sure that you have used your $50 for the quarter. We also have the nurse line, and we have chiropractic and acupuncture. You get 12 visits a year, and those are zero copay each. United Healthcare, of course, is AARP combined, and we have the AARP Medicare supplement, which I'm sure you've heard many commercials online about. So that is available to you as well. We also have 3 drug plans, and then this year we have a new plan called the Freedom Plan, which gives you an opt-out to go to a doctor outside of your network with a small copay. So if you have any questions, please feel free to give me a call. Again, my name is Rosalie, and my last name is Pulio, and my number is 714-292-3796. I'm happy to help you in any way I can. Thank you.
This concludes our Medicare Benefits class for today. Keep in mind, today's benefits class has been uploaded onto our Hoag YouTube channel for you to view at a later time. And also, if you have additional questions in regards to any of the specific plans that we spoke about today, please feel free to contact the health plan agents for each individual plan. Thank you again.